I would like to say that while significant progress has been achieved in recent years, the world is still confronted with considerable health challenges and issues generated by social exclusion and power structures which impede equity and entrench poverty in many nations of the world. The progress achieved, which I mentioned earlier in my presentation, while commendable, remember what I said, was uneven and insufficient, particularly in such regions as sub-Saharan Africa, where even the reports, with all the progress made, is still the one that's lagging behind almost all the other continents. Nonetheless, we live, and we must recognize the fact that we live in an increasingly interdependent world, whereby the developed countries are no longer far removed from the negative consequences and effects of poverty and health crises emanating from the developing world. I cited the case of the Arab Spring and the pressure that has led, that put on immigration into Europe, particularly Southern Europe. Most of the seemingly intractable problems affecting the world in this regard are best addressed through the exercise of effective and decisive leadership. Leadership is the key, within countries, between countries, and in international organizations. But in addition, and it's also a reflection of quality leadership, improved international coordination is very critical. If you recall, after the earthquake in Haiti, one of the response, generous response on the part of the international community, but what was lacking, coordination. So your money's unspent, services uncoordinated, people suffering, despite the commitment on the part of the international community to do something to the victims of that earthquake. What is said about that earthquake is also important in global challenges on health issues. We need improved international coordination and improved governance by international organizations and institutions established for those purposes. And at the bottom of it, we know, and you know, as educators, that education is the key. We know that the solution lies in principled education, in mentoring, and on an ongoing active role, particularly for the Methodist educational institution. They have to be part of the solution.